This video is a virtual anatomy lecture series directed by Dr. Strategy using Anatomage table. The manipulation and the annotation was done by Dr. Mai by Truong. The English script was monitored and recorded by Ms. Soyeon Kim, the PhD candidate. You can learn human anatomy easily with SNUSD Knowledge Share Initiative.
Let's continue with the inferior view of the skull. The mandible has been removed to show the inferior surface of the skull. From this aspect, we can see the maxilla, zygomatic bone, palatine bone, vomer, sphenoid bone, temporal bone, occipital bone, and parietal bone. Briefly speaking, the anterior part of the inferior view contains the bony palates. The bony palate is the anterior horizontal bony part of the palate that forms the roof of the oral cavity and floor on the nasal cavity. This is the bony palate. The palatine process of maxilla is a process of the maxilla that projects medially, articulates posteriorly with the palatine bone, and forms with the corresponding process on the other side, anterior 3/4 of the bony palate. The horizontal plate of palatine bone is located in the transverse plane. It comprises the bony core of the posterior quarter of the bony palate and a part of the floor of the nasal cavity. The incisive foramen is a funnel-shaped opening on the midline of the hard palate, immediately behind the incisor teeth, where the greater palatine artery and vein from the oral to the nasal cavity and the nasopalatine nerve in the opposite direction pass through. The greater palatine foramen indicated in yellow here is the opening in the posterior hard palate of the greater palatine canal, which is formed between the articulation of maxilla and the greater palatine sulcus of the palatine bone. It transmits the greater palatine nerve and vessels to the palate. The lesser palatine foramen is representing the opening in the hard palate of the lesser palatine canal, located just posterior to the greater palatine foramen. They transmit the lesser palatine nerves and vessels. The medial end of the posterior border of the horizontal plate of the palatine bone is acute, and when united with that of the adjacent bone, it forms a projecting process, the posterior nasal spine, where the attachment of the musculus ovale occurs. The palatine grooves are several grooves on the lower surface of the palatine process of maxilla, where the palatine vessels and nerves lie. The temporal process of zygomatic bone is oriented posteriorly and slightly superiorly towards the temporal bone. It articulates with the temporal bone. The zygomatic process of the temporal bone is a long arched process, projecting from the lower part of the squamous portion of the temporal bone. The inferior orbital fissure lies on the floor of the orbit, inferior to the superior orbital fissure, and is bounded superiorly by the greater wing of the sphenoid bone, inferiorly by the maxilla and orbital process of the palatine bone, and laterally by the zygomatic bone. Here is the medial pterygoid plate. The medial pterygoid plate of the sphenoid bone is a horseshoe-shaped process that arises from the underside of pterygoid process. The pterygoid hamulus is a hook-like process at the lower extremity of the medial pterygoid plate of the sphenoid bone. The lateral pterygoid plate projects posterolaterally, and its lateral surface forms the medial wall of the infratemporal fossa. The pterygoid fossa is formed by the divergence of the lateral and medial pterygoid plates of the sphenoid bone. The scaphoid fossa is a shallow oval depression that is situated above the pterygoid fossa and provides attachment for the origin of the tensor veli palatini muscle. Vomer is a small, thin bone separating the left and right nasal cavities. Choanae are two openings found at the back of the nasal passage, between the nasal cavity and the throat, which are referred to as the posterior nasal aperture. The styloid process is a cylindrical, slender, and needle-like projection of varying lengths averaging 2 to 3 centimeters. The mastoid process is located posterior and inferior to the external acoustic meatus, lateral to the styloid process, and appears as a conical or pyramidal projection. The squamous part of the temporal bone is the anterior superior portion of the temporal bone that forms the lateral part of the middle cranial fossa. It resembles a large flat plate. This is the mastoid notch, and this is the groove for the occipital artery. The mastoid notch is a deep groove located on the medial side of the mastoid process for the connection of the digastric muscle. The petrous part of temporal bone is pyramid-shaped and is wedged in at the base of the skull between the sphenoid and occipital bones. The mandibular fossa is the smooth, concave articular surface formed by both the squamous and petrous parts of the temporal bone. The foramen ovale is the oval-shaped opening placed obliquely in the base of the skull, connects the middle cranial fossa to the infratemporal fossa, and transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. The foramen spinosum is located in the posteromedial part of the greater wing of the sphenoid bone, posterolateral to the foramen ovale. It allows passage of the middle meningeal artery. The jugular foramen is a cavity formed by the petrous part of the temporal bone anteriorly and the occipital bone posteriorly, which is here. The Stylomastered Foramen is a rounded opening located on the inferior surface of the petrous temporal bone, between the base of the styloid process and the mastoid process of the temporal bone. The mastoid foramen is an opening at the posterior portion of the mastoid process, transmitting a small branch of the occipital artery, the posterior meningeal artery to the dura mater, and a mastoid emissary vein to the sigmoid sinus. The Keratin Canal, located in the petrous temporal bone, transmits the internal carotid venous plexus and sympathetic nerve plexus from the neck into the cranial cavity. This is the external orifice of Keratin Canal. And this is the internal orifice of the Keratin Canal. The foramen lacerum is a triangular opening located in the middle cranial fossa, formed by the continuation of the petrosphenoidal and petrocleval fissures. It is filled with connective tissue. This is the foramen lacerum. It transmits the small meningeal branches of the ascending pharyngeal artery and emissary veins from the cavernous sinus to the pterygoid venous plexus. The hypoglossal canal is a foramen in the occipital bone of the skull. It is hidden medially and superiorly to each occipital condyle. The hypoglossal nerve traverses the canal. The foramen magnum is here. It functions as a passageway of the central nervous system through the skull, connecting the brain with the spinal cord. Occipital condyles are two large protuberances on the undersurface of the occipital bone located beside the front half of the foramen magnum. It forms the connection between the skull and the vertebral column. The pharyngeal tubercle is part of the occipital bone, located on the lower surface of the basilar part of the occipital bone, about 1 centimeter anterior to the foramen magnum. The pharyngeal canal is a small, short canal located at the articulation of the sphenoidal process of palatine bone and the vaginal process of the body of the sphenoid bone. Spheno-occipital synchondrosis is a cartilaginous joint of the cranial base located between the sphenoid bone anteriorly and the occipital bone posteriorly. The nuchal lines are 4 curved lines on the external surface of the occipital bone. The upper, often faintly marked, is named the highest nuchal line, and it attaches to the epicranial aponeurosis. Below the highest nuchal line is the superior nuchal line. It attaches to the splenius capitis muscle, the trapezius muscle, and the occipitalis muscle. From the external occipital protuberance here, the median nuchal line descends to the foramen magnum and affords attachment to the nuchal ligament. Running from the middle of this line is the inferior nuchal line. Attached are the obliquus capitis superior muscle, rectus capitis posterior major muscle, and rectus capitis posterior minor muscle. Let's move on to the sutures in this aspect. The median palatine suture is a cranial suture between the right and left palatine. The transverse palatine suture is a cranial suture between the palatine process of maxilla and the palatine bone. Zygomatico-maxillary suture is a cranial suture between the maxilla and the zygomatic bone on the floor of the orbit. Zygomatico-temporal suture is between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. Petrosphenoidal suture is the suture connecting the greater wing of the sphenoid bone with the petrous part of the temporal bone and the middle cranial fossa. Petro-occipital fissure is the articulation between the lateral surface of the basilar part of the occipital bone and the posterior and medial surfaces of the petrous apex of the temporal bones. Occipitomastoid suture is the obliquely oriented articulation of the anterior border of the squamous occipital bone and the mastoid portion of the temporal bone. Sphenosquamous suture is a vertical suture between the sphenoid and temporal bones bilaterally. Parieto-mastoid suture represents the articulation between the parietal and temporal bones. Lambdoidal suture connects the parietal bones with the occipital bone. Let's continue with the measurement points. Ovale is the point where a line is drawn tangent to the inner margin of the sockets of the two middle incisors of the upper jaw and projected onto the hard palate, intersecting the mid-sagittal plane. Staphylon is the median point of the posterior edge of the hard palate. Basion is the midpoint of the anterior margin of the foramen magnum. Opistheon is the median point of the posterior border of the foramen magnum. This is the end of the lecture on inferior view of the skull. Thank you for listening.